The Trump administration's war on the scientific establishment ratcheted up last week as Secretary of Health and Human Services, RFK Jr., announced plans to cut nearly $500 million in federal funding for mRNA vaccine research. mRNA is a cutting-edge vaccine technology that was instrumental in managing the COVID-19 pandemic and has been cited as potentially transformative in the treatment of other infectious diseases and even cancer. Dr. Leana Wen joins me to discuss the repercussions from this decision and others. She is a Washington Post contributing columnist who previously served as Health Commissioner of Baltimore. Leana, welcome. Explain to all of us, just so we understand, what is it that is so special about the mRNA vaccine? I'm having sort of, flashbacks to COVID, and I think we all knew this, but just remind us.
Well, how the mRNA vaccine works, Fareed, is that it's essentially a set of instructions that tell the body to make a harmless piece of virus. And that way the immune system learns to respond to it. And then the next time when it's exposed to that disease, it knows to fight it really quickly. The reason why the mRNA technology is so transformative is that previously the traditional vaccine technologies may take months or years to produce a vaccine in large quantity. The mRNA process cuts that time down to a matter of weeks to months. And that time savings could really be a huge difference when it comes to a novel virus, as we saw during COVID, or if we have a pandemic in the future where we need to have large scales of vaccines be deployed and manufactured, then we do need technology like mRNA instead of relying on cells and egg-based vaccines that will take a lot longer.
And what do you make? I'm sure you saw the piece by Jay Bhattacharya, the new head of the NIH, which said, look, we're still doing some basic research, but there were a lot of potential side effects. So we didn't know what the correct dosage was. There were all kinds of unanswered questions about mRNA that we need to first thoroughly investigate before we jump all in on the mRNA. What do you say to that?
I would say that at this point, the mRNA vaccines, specifically the COVID vaccines from Pfizer and Moderna, are some of the most well-studied vaccines in the world. They have been given to hundreds of millions of people worldwide. There are many studies now showing their safety. We do know that in terms of efficacy, that they are not so effective at preventing disease, but they are very effective at reducing the likelihood of severe disease, especially in vulnerable people. We also know that there could be potentials to treat cancers. There are now clinical trials ongoing, for example, to treat pancreatic cancer using mRNA technology, which is a very deadly cancer. Why would we not want to have every tool at our disposal and continue the investments that have already been made?
The cuts to the NIH and to the NSF, the National Science Foundation, are pretty substantial. I mean, you're talking about 40–50% of their budget. Is this, describe for us, you're working scientists on the ground. What does this mean? I'm assuming it means whole labs shut down and things like that.
We are already seeing many scientists have had their grants halted, often without explanation, but then they find out that their grants their research contain keywords like health disparities or gender or health equity or HIV or coronavirus or vaccines, any number of things that this administration seemed to not be in favor of. We're also seeing billions of funding to academic institutions, to universities being put on pause or frozen. The universities then have had to significantly restrict their budgets. There are hiring freezes. Offers that are made to postdocs, graduate students, faculty have been rescinded in some cases. And many researchers are now really scared. And so there are already really significant impacts on American scientists and also on young scientists, many of whom are now saying, well, they don't know if they want to stay in the sciences because they don't know if there's a future for them here.
And what are you sensing? You wrote your column in the Post about the way Europe is aggressively trying to recruit American scientists. My own anecdotal evidence is that China has been laying out the red carpet for all the graduate students being kicked out of America. Are these numbers at this point significant? I mean, should we think that there is actual there is a kind of erosion of America's scientific supremacy?
I think the brain drain is real, and it is very true that our infrastructure that we've taken so many years to build is actively being threatened. I spoke recently with the president of Aix-Marseille University in France, who said that back in March, he was hearing all these stories of his colleagues whose work was being censored and whose grants were being cut and who were being forced out of their jobs. And he started this program at his university for welcoming and recruiting American scientists. And they are on track now this year to welcoming about 30 American scientists. They received over 600 applications, I believe, from scientists at Hopkins and Stanford and Columbia and even at NASA. And this idea is gaining traction. The European Union is investing 600 million euros to recruit American scientists. The French Parliament has a bill to establish a new category for scientific refugees from the US. And I just have to say, this is really unimaginable, even a year ago, that this was going to be the case. Aix-Marseille University currently welcomes refugees from countries like Syria, Lebanon, from Ukraine. Who thought that the U.S. would be joining that list?
Lena, pleasure to talk to you. Thank you so much for joining us.
Thank you, Fareed.